Winter is almost here, so does that mean COVID is going around again? What will COVID look like for the rest of winter? 1. Uncertain predictions for winter 2024 to 2025. Predicting how COVID-19 will unfold this winter isn't straightforward. It's like trying to predict the weather 6 months in advance. Why? Because so many factors come into play. One key element is how the virus evolves. Viruses like COVID-19 constantly adapt, aiming to survive in a world where people build immunity through previous infections and vaccinations. Then there's the weather. Cooler months often mean more time indoors, which creates conditions where respiratory viruses thrive. And, of course, immunity levels are critical. The protection we gain from vaccines or past infections doesn't last forever, and as it fades, the virus might find opportunities to spread. Experts suggest that as the immunity from fall vaccinations begins to wane, we might see an uptick in cases in spring. This isn't a guarantee, but it's something health officials are keeping an eye on. The good news? So far, the virus hasn't evolved as quickly to bypass immunity, which gives us some breathing room. While uncertainty remains, staying informed and proactive can make a difference. As conditions shift, keeping an eye on public health updates and adapting our habits can help us navigate the rest of the season. 2. COVID-19 symptoms in 2024. COVID-19 symptoms are evolving, but mild respiratory issues remain the most common. Think congestion, sneezing, and a sore throat. These symptoms are so similar to colds or the flu that it's almost impossible to tell them apart without testing. One standout symptom is the loss of taste and smell, which is more frequent with COVID-19 than with other respiratory illnesses. If you experience this, it might be a strong hint that you've been exposed to the virus. Complications like pneumonia, though less common, are still a concern. Symptoms such as fever, a persistent cough, and shortness of breath could indicate something more serious. Timing is also important. Symptoms can appear anywhere from 2 to 14 days after exposure, so if you've been around someone with COVID-19, keep an eye on how you're feeling. Experts have noted that the current dominant subvariant, XEC, behaves similarly to previous variants. It isn't causing more severe illness, which is a relief. However, it's still contagious, so staying cautious is key. If you're feeling unwell, don't dismiss your symptoms as just a seasonal sniffle. Testing remains the most reliable way to determine if it's COVID-19 or something else. 3. Preventing COVID-19 spread. The tools to prevent COVID-19 are in our hands, and they're simpler than you might think. Hand washing is one of the easiest and most effective habits. Keeping your hands clean can stop the virus before it gets a chance to spread. Masks continue to be a powerful way to protect yourself and others, especially in crowded places or during travel. When you're on a plane or in a busy terminal, wearing a mask can reduce the risk of exposure. Ventilation is another critical factor. If you're indoors, increasing airflow by opening windows or using portable air filters can make a big difference. If you feel unwell or suspect you have COVID-19, act quickly. Get tested as soon as possible to confirm. If you test positive, talk to your doctor about treatments like Paxlovid, which can help reduce the severity of symptoms. And remember, staying home while sick protects your loved ones and the community. Hygiene practices are also essential. Cover your mouth when you cough or sneeze, clean frequently touched surfaces, and wash your hands regularly. For better air quality at home, consider HEPA filters or maintain your HVAC system by changing filters as recommended. For vaccination and immunization. Vaccines are our best defense against severe illness, and staying up to date is critical. The CDC has high confidence that the 2024 to 2025 vaccine will work well against current variants. This means getting vaccinated now can reduce the risk of severe illness, keeping you out of the hospital. If you haven't received your updated vaccine yet, there's still time to do so this season. Vaccines are especially important for older adults and those with underlying conditions. Protecting yourself also helps protect the community, as it reduces the overall spread of the virus. Vaccination isn't just about avoiding COVID-19. It's about minimizing complications if you do get sick. Severe outcomes, such as hospitalization, are far less likely for those who are fully vaccinated. Consider making your health a priority this season by staying informed about immunization options. 5 projections for COVID-19 impact. Here's some encouraging news. The CDC projects that hospitalizations this fall and winter will either be on par with or lower than last year's peak. That includes not just COVID-19, but also influenza and RSV. This trend suggests that the tools we're using, vaccines, hygiene measures, and better air quality, are making a difference. It's a collective effort, and every step matters. While we can't eliminate COVID-19 entirely, we're learning how to manage it more effectively. Staying vigilant, making informed choices, and supporting public health efforts will help ensure that this winter is safer for everyone.